you started with this protocol, where you felt a change? What is the change that you notice? And if you can tell the world, what's the change that you notice, and how quickly did it occur for you in this protocol?
So the first change was the cough stopped, and that was 3 days or after the first, or yeah, 3 days after the first protocol.
3 days after the first remedy, the first day.
Or remedy, yes.
Okay.
3 days after the first remedy. That's when the cough completely vanished.
Excellent. And it's been gone now for more than 3 weeks, the cough.
Oh, yes.
Completely gone.
Yes, completely gone.
And then the next thing that happened after the cough stopped?
And then I want to say about a week later is when I didn't feel like I needed to gasp for air. I can just breathe fine.
A week later, so saying about 3 days, so you're saying about 10 days into this?
About maybe less, about
so like
7
days into the protocol, 7-8 days into the protocol. So by day 7 or 8 of taking these steps, now you could actually breathe without shortness of breath, no gasping for air. So no more coughing. In the first 3 days, the coughing stopped completely. It hasn't come back in now almost 4 weeks. Still able to stand up. You're able to stand up and not have the heart rate just go, elevate incredibly. Yes?
Yes.
You're able to, are you lying down on your back in bed now?
Yes.
You can, so you don't need to sleep elevated anymore. With your back up against the pillows or headboard.
Yeah.
You can the cold body feeling.
Mm-hmm. Yeah, before I couldn't be, if I was in my house, I had to have the heater to maybe 80, 82. And now, I have it 69. And the temperature in the house, and I feel fine. Mm-hmm. I always had to be carrying a blanket around with me. Always had to have a thick jacket. And now I'm fine.
But we have made a dramatic improvement so far in this first month.
Yes.
Even in the first 10 days, dramatic improvement.
Oh, yes.
It's been massive.
Massive.
Yeah, we're in the house. This wasn't like this. The routine before, it was she'd get up, get in the wheelchair, take it to the car, and then feed her yogurt, anything, and then that was it. So she had to go to bed.
All right. Yes.
You can shower for yourself.
Yes.
You can.
Now it's back to.
I have my life back.
Well, let's start off with this one. Let me restart. Okay. If any of you have POTS condition, if you have shortness of breath, rapid heart rate, anxiety, panic attacks, cold body feeling, and you're suffering, going to different doctors, and you just don't know what to do, the doctors are not helping you, the medications you're taking are not making the biggest difference in you. Maybe they made a slight difference in you, but they're not making the biggest difference in you. Let's meet right now Mr. and Mrs. Cruz. Mrs. Cruz, you came to me, both of you came to me back in December of 2018.
Yes.
Right? Yes. And right now, that was December 4th of 2018. And right now we are on, today is January 11th of 2019. Mm-hmm. Right? And the reason why you came to me, I'll go with you first, Mr. Cruz. The reason why you came is because, let's even not go there. Let's talk about first about what your history with what was called POTS condition was, okay? And we're also going to put up, just so everybody knows, we're going to put up a video of Mrs. Cruz from before, just when she was getting started, or the day before she was getting started with her unique protocol that's brought her to this incredible improvement that you're seeing right now. And also, if we say that the video doesn't even do it the greatest justice of what was going on with you, right, with your symptoms.
Yes.
It was a lot worse than that.
Yes.
Yeah. So that was
it was probably twice as bad as.
Probably twice as bad. So I'm going to do a bit of an imitation with your approval of what I saw of how bad it was in my exam room here, of how bad it was. So let's let's pull up that video first, and this is you. So let me hit play here. We can all see this.
Hi everybody. Dr. Herman asked me to get up before and after. This is a before. My wife's going to start her first protocol. This is how she was. She has this cough, shortness of breath, I mean, she could hardly eat. She's on all these meds. She got diagnosed with POTS, and this was for her nose. She has her nose blocked up. There's so many things that doctors, we've gone so many doctors, so many emergency rooms, we can't figure out. And we're about to start the first protocol for my wife, and this is a before, and we're gonna get an after.
Okay, so that video, I know right now I think I'm just gonna give a little bit more of the kind of expression that I saw when you were in my clinic. And what we did see there was you were lying back but propped up because you could not lie on your back, correct?
Yes, correct.
And you couldn't lie on your back because what would happen if you lied flat on your back?
I felt like weight on my chest, and I would feel out of breath. Couldn't breathe.
And even though you were still out of breath there, just not as bad as it would become worse when you're lying on your back, flat on your back. Yeah. And how long were you suffering with this shortness of breath, the coughing, and the POTS, the rapid heart rate condition for? When did it all start?
I had little symptoms maybe 8 months ago, but
Not a month ago from now. When did it first start? You were suffering for how long before you came to me in December?
It was 8 months from December.
8 months ago. So 8 months from December. So about April of 2018 is when it first started.
Yes, around that time.
And Mr. Cruz, you were saying when it first started, what was the first symptom that you said you first noticed with her? Before I do the imitation of how bad it really was, what was the first thing that you saw with her?
The first thing was, it started with the nose. She just couldn't breathe. That's when we started going to ENTs to find out why her nose, why she couldn't breathe. She kept putting we call that nose spray on her nose.
Right.
She just kept constantly taking those.
The nasal sprays that you stick up your nose and spray, yeah.
And
that wasn't helping.
No.
I think the first one was. I think the first sign was I was trying to work out. I was trying to do the P90X, and
way back.
and my heart rate elevated really high, to the point where I almost passed out. I think that was one of the first signs, and then after that was the nasal, when I started using the nasal spray.
And then the nose situation. And what kind of doctor told you? Did you just use the nose spray on your own, or did you go to a doctor?
No, the ENT.
ENT told you, okay. And then from there, it just further downhill?
Yes.
And what was the next step or next symptom that you noticed? So the rapid heart rate was going on, the nose kind of congestion, inability to breathe in through the nose. What then happened?
So after that, the heart rate would just stay there, with any little, very minimal movement. It was just always elevated. And that's when the shortness of breath came in. To the point where I couldn't move, because even just lifting or raising my arm or my leg would make me feel like I was going to pass out, I didn't have enough oxygen. And then from there, just not being able to eat, being so weak, not being able to get up, or even sit down or lay down.
One after another.
One after another. And the shortness of breath, I'm going to do a bit of the imitation now of what I saw in my clinic. When you were sitting on the exam table or lying down, trying to lie down, or lie back up against a few pillows on the exam table, up against the wall, really, it was. So you're sitting almost upright, it was. You were so weak, but you were breathing. It was more like this. And then a little cough like we saw in the other video that we just saw, and then back to the and any movement, even just like I had you lift your head in the exam or move your arm to your, doing a certain neurological test, it made it even worse, where we had to take a break in the exam room. You were just too weak, and the breathing became so difficult that it almost, I was really worried that you were not going to be able to get any air in your lungs at that time.
Yeah.
It was that bad.
Yes, it was that bad. It felt like I wasn't getting enough oxygen.
And she even has the little thing to tell you what's the oxygen level in her head, and it kept saying 100.
The pulse ox, the fingertip.
Yeah.
And it kept saying 100, like it was normal. But she looked like somebody was stepping on her chest and she couldn't breathe.
Yep.
Yeah.
Yeah.
Exactly.
I'm sorry if that's a bit graphic, but that's how bad it was. It was like somebody
Yeah.
was just like crushing your chest.
Yeah.
And you also were in a wheelchair at the time when you came to me in December of 18.
Yes.
And that's because why?
One was because of the rapid heart rate. Because every time, any little minimal movement I would do, my heart would just elevate to 160. And two was because I was so weak that I mean, it was the only way I could move around, or they could help me move around.
Mm-hmm. So sitting in the chair, the heart rate in the sitting position in the chair, the heart rate wouldn't go up much higher?
No, because I would just transfer from my bed to the wheelchair. Stay there all day. I mean, if I had a shower, I had to be in the wheelchair. If I had to do anything, I mean, I lived in the wheelchair.
And how many months was it in the wheelchair? Before you came to me, how many months? Before December?
3 months.
Around 3 months.
Around 3 months. And so you had gone through, before you came to me in December, and we're looking at, let's talk about now, where you are right now, excuse me, and then we'll go back to your history of the kind of doctors and hospital visits and so on. Right now, the difference in your breathing, which I'm just going to tell everybody who's listening to this video, watching this video, when I had the first consultation, the first discussion about your condition, Mrs. Cruz, back in November 20th of 2018, you were not able to speak, were you? He was doing all the talking. He was answering my questions.
Yep.
Yes, and I also want to add that around the last month and a half before we spoke to you in November, I couldn't be in my house because of really bad anxiety, and I couldn't speak or anything. All we would do was just sit in the car.
Wow.
Yeah.
How long are you two together?
9 years?
9 years.
Okay, 9 years. You know each other pretty well. So you're in the car because the anxiety was just too great in the house.
Yes.
Super, yeah.
Any building.
Any building.
Yeah.
Yeah.
So it became almost like, but it wasn't a claustrophobia because in the car.
No.
So that wasn't it. Okay.
It was more of like I felt like I wasn't getting enough oxygen.
That's very interesting and incredible. So
Yeah.
you now again, when we were in that phone discussion that day in November, I remember asking you, Mr. Cruz, I said, I don't know if you know the answer to these questions. Can I speak to your wife? And you said, your answer to me was, you don't understand. She can't talk.
You can't talk. Yeah.
And I was thinking more like, was there a paralysis of the tongue or paralysis of the
Yeah.
voice box, or did she lose her voice or something? And the reason was because she
I
couldn't
was
talk.
sorry.
She was out of breath.
Short of breath.
She
You
was
couldn't even get
she
any
was
words
too weak
out.
to even talk. Yeah.
Yeah, you did all the talking. Even here,
Yeah.
when you came to my clinic in December 4th, you did all the talking. There was nothing coming out of her mouth, speech wise, just gasping for air and coughing.
Yes.
Yeah. So right now we're at a point where you are so incredibly improved. Like to me, it looks like night. Yes, I'll let you talk. You tell me. It's like night and day for me. I'm so excited to even. When I called you and heard your voice on the phone, I was stunned.
Yeah. Yeah.
I'm
She can yell at me now.
Now she can yell at you. That's back. So.
Had a couple months of no yelling. Man, I'm doing everything right.
So you are looking like, I mean, to me, you look like 100% better. I'm not just saying about you've got your hair done and makeup and glasses. You look like you can care for yourself again.
Yes.
But the smile on your face, which was 0 smiles when I met you because of the agony you were in, but also your voice, I heard your voice for the first time now, and you are breathing just about 100% normally.
Yes.
You can walk around?
Not fully, but yes.
Not fully. So what is it right now that it's not full?
My heart still sometimes goes,
Yes.
elevates.
Yeah.
How much?
Well-
Sometimes. So when you stand up, it goes up?
No,
It's
not anymore.
Okay. So when you walk for a certain period of time, it goes up.
Or a certain, yes, correct.
About how much time do you have to walk around for it to go up right now? Like 1 minute, 10 minutes, a half hour?
No, she just a couple steps, and every time she does it, it's always a little more.
Mhm.
So like she may not notice it, but I notice it. Like, oh, you walk from here to here now.
Mhm.
You know, it's
So
like
we're getting better. And right now we're making this video where you're only 1 month into a 3-month protocol for me. From the
I
exam
think
that
it's
we had.
less than a month.
Well, okay.
Yeah.
So let's say 28 days or so.
Yeah.
Yeah.
Something like that. But you're having 28 days compared to what we have a 90-day, for this case, for you, protocol is
Yes.
pretty much around the 90-day protocol, and you're at, let's say, 28 days. So
Yeah.
give or take a day. but your improvement in your breathing, your ability to breathe. And the reason why I say that, I'm sorry, let me go back, is that she's not even done with her entire protocol, and yet you're still able to stand up. You're able to stand up and not have the heart rate just go, elevate incredibly. Yes?
Yes.
You're able to, are you lying down on your back in bed now?
Yes.
You can, so you don't need to sleep elevated anymore. With your back up against the pillows or headboard.
Yeah.
You can lay on your back and no more rapid heart rate from lying on your back.
Correct. Yes.
You can shower for yourself.
Yes.
You can dress yourself.
Not fully.
Not fully.
I just can't bend down all the way.
Gotcha. What happens when you, at this point, 1 month into just about a month into this protocol, what happens when you bend down?
My heart I still feel it a little elevated.
Okay. So, but you can lie on your back now, which is dramatic change from what it was just a month ago.
Yeah.
And your breathing what's the difference in breathing, which since we can hear your voice and you're not gasping for air and coughing constantly?
Yeah.
What is the difference in your breathing? What do you feel like now? And how quickly did it happen when you started with this protocol, where you felt a change? What is the change that you notice? And if you can tell the world, what's the change that you notice, and how quickly did it occur for you in this protocol?
So the first change was the cough stopped, and that was 3 days after the first 3 days after the first protocol.
Mm-hmm. 3 days after the first remedy, the first day.
Or remedy, yes.
Okay.
3 days after the first remedy. That's when the cough completely vanished.
Excellent. And it's been gone now for more than 3 weeks, the cough.
Oh, yes.
Completely gone.
Yes, completely gone.
And then the next thing that happened after the cough stopped?
And then I want to say about a week later is when I didn't feel like I needed to gasp for air. I can just breathe fine.
A week later, so saying about 3 days, so you're saying about 10 days into this?
About maybe less, about
so like
7
days into the protocol, 8 days into the protocol. So by day 7 or 8 of taking these steps, now you could actually breathe without shortness of breath, no gasping for air. So no more coughing. In the first 3 days, the coughing stopped completely. It hasn't come back in now almost 4 weeks. And the breathing, the shortness of breath has disappeared, and it hasn't come back. I mean, you're not exercising, you're not out on a treadmill, you're not doing any you're not straining yourself terribly, but you're functioning where you can breathe.
Yes.
Yeah, that's awesome. And I mean, it's just, nobody knows, just watching you in that video we showed before, but not really being able to see what it was like when I examined you in my clinic, how bad, how severe it was. It was terrible. Yeah. And I wish I would have taken a video of that, of how terrible it was. I mean,
yes. Yeah. I wish somebody would have recorded too.
Yeah. What was your family thinking? And what were you, Mr. Cruz? I'm sorry. What were you thinking? What were you thinking the whole time when she was going through this with her inability to breathe, when she was short of breath and coughing constantly and couldn't stand up, and rapid heart rate and just feeling horrible, and the anxiety was another situation that was going on with you? What was going through your mind when this was, besides I have to help my wife get better, but like what was, I mean, what kind of thoughts did you have when it was in such a horrible state?
For me, when I started to go through all this, like, I just had to find an answer. Honestly, there was no time for me to. Every day, I just kept looking for find a way to fix, to help her, to fix whatever's wrong with her. I didn't even. Every time I could see her get worse and worse, it just was just motivation for me to like keep looking for answers, keep looking for this, because she was too weak. She it's like for her, everything was going down. There was no time for me to even focus on how worse and worse she was. It was just, I need to focus on how can I find answers, where can I, I got to fix her. So whether it was going to emergency rooms, whether it was going to doctors, anything, acupuncture, you name it. I was looking through hundreds of hours of YouTube videos of other, until I found you, of course, but for any solution, any answers, that really was all. That was all.
That was
consuming your mind. Worse was just like there was no moment for me to just sit there and just I just had to just take action.
You had to take it. There was no worrying about it. It was just like, get it done, figure it
I
out.
got it done. You know, I just every day was I got to look for an answer. I got to look for an answer. It was never really a giving up. There was no moment of me.
You had to go through a lot of videos then.
Yeah, I went through a lot. I've looked. I can't even tell you. The algorithm on my YouTube is ridiculous.
Something made sense to you about what I was presenting, though, that this seemed to be.
Honestly, I probably watched like 70% of all your videos from the beginning to your. I went to the bottom of your videos and went boom, boom. But you understand what was the protocol? What is this? What does that mean?
I don't really come up with it. I don't talk about it in great detail, but.
Yeah, I know. I try to go through so many videos trying to see peek a little here, peek a little there, understand what it was, because you're the only one that stood out. I saw Clinic Mayo. I saw there was another one that was big on POTS, and his information led me to nothing. There's another one that was about what do you call it? Tachycardia. There's just so many channels that I was just going through all their videos and nothing came close to yours. Just went to straight detail. But the whole time just seeing my wife is just, for me, it was I can't show any emotion. I can't show anything. She's already feeling bad. I gotta figure out an answer. I mean, inside, of course, it was not feeling well, but I have to. There was just nothing. I had to take action. So it's hard for me to even tell you. I just don't think that way. I don't know how else to explain it. I just have to figure out, what's wrong with my wife. That's all that was always in my head every day.
Yeah, because the doctors that you were seeing, and you saw, you were telling me you'd been to the ER how many times?
I went like 4 or 5 times.
And you went to you saw another professional physician, a cardiologist, I think you said?
Yes.
And that's the one who diagnosed you with POTS?
Yes.
We don't have to talk about names of these doctors. We're not talking about them. But you went to 4 or 5 ER visits. You had a cardiologist visit. You also said you went to an ophthalmologist?
Correct.
Because you were thinking something about the eyes, or?
Yes, something, that had to do with the eyes connected to the brain.
Okay. You saw how many different, general doctors I think you saw? Just regular primary kind of physicians you saw?
3.
3 of those. And what kind of tests were these? And you also, I think, because you were having panic attacks from this lack of breathing and situation.
Yeah, I was having really bad anxiety and panic attacks. Every time that I would go to the ER, they would tell me that my heart and being out of breath was because of the anxiety. But in my mind, I just knew, no, there's something wrong. Like, it's not the anxiety where, like the mental anxiety. It's something's causing it.
I mean, the anxiety wasn't causing the shortness of breath. You had shortness of breath first. You had rapid heart rate condition. You had uncontrollable body function, and that caused you to be anxious.
Correct.
Yeah, so they were saying the anxiety is causing this, but you're like, no, I never had anxiety. Now I'm having panic and anxiety because my body's not working right. Figure it out.
Yes.
Yeah. And you had, what other kinds of tests did you have run? Were there blood tests, basic blood tests and urine tests?
Blood tests, urine tests, CT scans, MRI.
And even, I think you told me that you also had, the cardiologist did a test with you that was difficult?
He did the one that you get on the treadmill and then they connect you to the machine. And you have to walk. And I couldn't even go for a minute. My heart just elevated very quickly to 170. So.
And then they cut off the test.
Yes.
And is that where that doctor said to you, POTS is your condition?
Yes.
Okay. And so again, we saw in the video that we just showed before, there were several different pill bottles, medications, and you had the nasal spray. There was something else I think you were telling me, Mr. Cruz, that because the nose, it looked like the nose was swollen inside.
Yeah, we went to an ENT.
ENT. Eye, ear, nose, throat doctor.
Can breathe.
Right. The eye, ear, nose, throat doctor.
Yeah.
So that's another physician. And what did that physician tell you about her nose that was causing this whole situation? What did they say?
That she's going to need surgery. You got it.
That the turbinates were swollen, so I was going to need surgery to reduce swelling.
Are you breathing okay now without the nasal spray?
I still use it, but not before. I had to use it like maybe every hour,
Mhm.
Yeah.
So
every
how
half an hour.
how often do you use it right now?
She was like,
I use it maybe in the morning sometimes when I wake up, or at night sometimes when I go to bed.
Because it still feels as if it's congested in the sinus or nose area.
Yes.
The terminate area feels a little swollen still.
Yes.
All right, we're gonna get all that to calm down. We're gonna get all that to calm down. And you say yes because you have a strong feeling that it's all going in the right direction now. You're pretty
Yes.
confident. Yeah. Are there other symptoms that we haven't covered right now? Anything else that we haven't covered that's still bothering you or that was bothering you? Because again, I just saw that the heart rate, the weak, not able to eat, sitting in the wheelchair, not able to take care of yourself, and the nose and the whole breathing, that horrible breathing situation.
Yeah. Oh, I don't know if we mentioned the.
The cold body feeling.
Yeah, before I couldn't be. If I was in my house, I couldn't. I had to have the heater to maybe 80, 82, and now I mean I have it 69, and the temperature in the house, and I feel fine.
Mm-hmm.
I always had to be carrying a blanket around with me. Always had to have a thick jacket, and now I'm fine.
And even in an 82-degree weather, that Fahrenheit temperature house,
I
you still had the blanket.
Yes.
And now you can walk around in 69 degrees with probably pants and a t-shirt and
Yes, and I'm fine.
feeling okay. So the cold body feeling is gone.
Yes.
And so, but we still have a bit to go with your protocol. We still have a couple of months to go with this first protocol. And there's a lot of different steps to clear up different hidden disease-causing infections and toxins out of your tissues. And tissues like in the brain and the kidneys and so on. That's only going to make you stronger. It's only going to get you better. So the heart rate still does go up if you try to take too many steps. And the heart rate can go up if you bend over and to like you told me before, to like put on your shoes or socks or something like, or bend over and pick something up. You'll have your heart rate not stable yet. But we have made a dramatic improvement so far in this first month.
Yes.
Even in the first 10 days, dramatic improvement.
Oh
it's
yes.
been massive.
Massive.
Yeah, I mean, we're in the house. This wasn't like this. A routine before, like, it was she'd get up, get in the wheelchair, take it to the car, and then feed her yogurt, anything, and then that was it. Till she had to go to bed. And she used to use a sleeping product to help her just knock out, to calm it through all the anxiety. Same thing. Get up, go back to the car, like that till we were able to get to your meeting and then finally get back to Houston and start the treatment.
Mm-hmm.
And I mean, now it's back to.
I have my life back.
That's awesome. That's so awesome.
Yeah, every day, just one after another little improvement that everybody in the house will notice. She might not, but you get that or nowhere.
Yeah.
It's just little things just keep piling up, and like I said, I know when she reaches day 45, I see how you broke down all the treatments, how they're going to work, all the protocol, and I can't imagine what's going to happen when we reach some of the areas that you're focusing on.
So many more. That's only going to get her stronger. It's only going to get her better.
Yes.
I mean, I'd be really impressed if there's a complete recovery in that period of time. It might be. It's going to be the most amazing thing, and we're going to look at you again and see you again, because I'll see you in March of 2019, and already this amount of improvement is just stunning. It's stunning. It's awesome.
I mean, this alone, before it was you and me always talking. Now she could do all the talking.
She could do all the talking. And laughing and
Yeah.
smiling and talking. And the first time I heard your voice was yesterday on the phone, and I just couldn't believe it. I mean, I shouldn't say I couldn't believe it. I'm just amazed. It's incredible. It makes me happy. We're ecstatic here in the office to see the amount of improvement you have. If you could tell people now who are listening to this, if there's anything else that you could say, and then we'll close up with this recording right now, but if you could tell anybody how bad it was, and the doctors that you went through, and what you felt coming out of those doctors' offices, meaning in the sense, because I just have a strong feeling, and I speak to a lot of people who deal with POTS and shortness of breath issues who I help get well, where they come out of the doctors and they just feel like the doctors are just not really understanding what's going on, or don't have don't have a clue. So if you could tell people how you felt coming out of a doctor's office then and coming out of the office from me here, and the difference, maybe there's also a way to talk about the, if you could say like a percentage of improvement, maybe, percentage wise, you can give a number, quantify before you came to me, what you dealt with for those months, 8 months, and now how you're feeling. So what was it like with those doctors between that and what you came to me, and then the percentage wise?
Yeah. For the doctors, I feel like, yes, they don't really know what, they're talking about. And then also, I feel like because you're not dying, they don't really care for you as much as, if a patient, who's dying walks in there. I also feel like they don't really listen to the symptoms and stuff you're telling them. A lot of doctors, I felt like they were telling me like I was crazy, like it was in my mind.
Yeah, I still receive calls from the clinic for psychiatrists or her.
Yeah.
I'm like, okay, yeah, sure thing.
Yeah.
I don't, she don't need that, but they keep telling me, recommending me to take her.
Yeah.
Wow.
And then percentage-wise, I feel like I'm at a 50% compared to how I was when I went with you.
Mm-hmm.
I honestly do feel way better. I feel like I have my life back. I feel like I can be myself again.
Yeah.
She did her nails, she does her hair, her makeup. I mean,
It's incredible.
Yeah.
Yeah.
I mean, it's just stunning to hear your voice and see you breathe and not choking, not I shouldn't say choking, but coughing and the gasping for air. Like you look like somebody was actually just. I'm not kidding. I wish I had the video of what it looked like here, because it was like somebody was actually standing on your chest, and you were just barely able to get a drop of air in your lungs. It was just horrible. So fascinating. And either of you could just tell someone, it's been worth it. Yes? I'm not convincing you. I don't have to convince you anymore of what's going on here.
no, you don't. And honestly, if anybody who's ever watching this video, make the appointment, call his office. It speaks, these results speak for themselves. If you're watching this for someone like I did, send them here. Take them to Dr. Herman. Trust me, it's the money. It's not even quantifiable what you would pay to getting someone's life back like that. People say all the time, I will give my life or I'll give an arm and a leg to get my wife's life back, or someone you care about life back. Well, you don't have to give an arm and a leg for Dr. Herman, but trust me, you can get your significant loved other or yourself life back. Just make the call. Just do it.
Excellent. Thank you. They're going to appreciate that. Okay, and I'm going to merge into another video and describe the findings that I discovered, if that's okay with you.
Yes.
Yeah, so I'm going to make another video about these findings and a bit more about what I've done with you to get you to this point where that's so impressive. And then we'll take another look, maybe hopefully with another video in March when I get to see you in person.
Yes, of course.
Right.
And thank you, Dr. Herman.
You're welcome.
Thank you.
Awesome. All right, I'm just going to stop this here. What's that?
I wouldn't be here speaking and breathing fine if I wasn't there.
Yeah, absolutely. Okay. Yes, if you're suffering from POTS syndrome, postural orthostatic tachycardia syndrome, if you've got shortness of breath, if you're taking medications and they're not helping you as much as you hoped, as much as you wish, there are some answers in this video that you probably have never heard before by the top doctors that you've seen, that you've been examined by, that you've been tested by for your POTS condition and or the shortness of breath condition that may accompany the POTS condition. My name is Dr. Lonnie Herman, and as you just saw in the video that the interview that I did with Mr. and Mrs. Cruz, the amazing results that she's experiencing so far are just they're beyond amazing. They're incredible. And I wish that I would have done a video of her when she was in my clinic in the exam, because there's almost no way for you to really appreciate the horrible condition, the shortness of breath, the
the feeling of loss of, like she was losing her life that she was experiencing when she was here in my clinic in December of 2018. Right now it's January 12, 2019 that I'm making this video, along to accompany that video that you just saw with Mr. and Mrs. Cruz. I'm going to do a bit of an impersonation. I'm going to do a bit of a sample of, I think, what's a pretty good impression of how she looked, of what it was like with her in my clinic. And I did get approval by Mr. and Mrs. Cruz to share with you, as you did hear in that video with with what Mrs. Cruz said, that she wished, at this point, she wishes that we would have done a video the first day that she was here in her examination, the first and only exam that we've had so far with Ms. Cruz. Because the change that she's experiencing now from then, again, is pretty difficult for you to even appreciate without seeing what she was like before. So I'm going to show you right now what it was like. First of all, in this video, I'm going to show you what it was like, what kind of breathing stress she was under, and then I'm going to go over some exam findings to help describe to you, help you understand what I've done for her so far, what I found with her, the hidden disease-causing infections and toxins that are connected to causing, in her case, in her individual case, the terrible shortness of breath that she was experiencing and the rapid heart rate that she was experiencing, and that she still is continuing to experiencing to some degree and only in certain positions. Well, I shouldn't say certain positions. I should say, as she said in the video, it happens after she's up and tries to walk for a few steps. But as she did say in that interview video, that she does not feel the rapid heart rate change in a position when she's going from sitting to standing. It does not happen anymore. It's totally stopped right now. So it does still occur, and she's only through the first month of a 3-month protocol. Not even through the entire first month. She's about maybe day 28 or day 27 into her protocol of a nearly 90-day protocol that I prescribed for her from the unique examination process that I performed with her when she was in my clinic. But I'll tell you something. She was sitting in a wheelchair. She couldn't stand up. The legs were too weak. The rapid heart rate would just... the tachycardia was out of control. She told me that her heart rate would go up to 170 beats per minute when she would stand up. Her heart rate, resting heart rate, when she was lying down on her back was 115. When she turned to her right side and her left side, or tried to sit up on the bed, it would go up to about 120 or 130, her heart rate. And we know that resting heart rate, healthy resting heart rate, should be closer to 60. 60 to 90 beats per minute is a very good resting heart rate. Yet even somebody who's very in great cardiovascular shape and great respiratory shape, when somebody's, let's say, a marathon runner, maybe they're a gymnast or so, they may have their resting heart rate down to about 50 or in the mid 50s. So maybe some have a bit better than that. I don't know, but basically 60 to 90, 90 is the high end of normal. She was 170 when she would stand from sitting to standing. So here's the impersonation I'm going to do of her when she was when she was in my clinic in the wheelchair and when she was on the exam table. Her breathing was like this. That is no exaggeration. Actually, her husband, Mr. Cruz, said that I was really on point with the type of impersonation I did with her, just what I showed you. That was her breathing. As you can see the difference of what I just showed you and what you just saw in the video with her, and that interview I just did with her on January, I think that was 11th of 2019, just yesterday evening. She is breathing just about 100% normal now. She can laugh, she can speak. In the consultation, she couldn't even speak to me. In the consultation, the first consultation that we had was November 20th of 2018. She could not even speak. The husband, Mr. Cruz, was doing all the discussion with me. He was answering all my questions. And when he turned to her, because I said, I want to speak with your wife, and he said, you don't understand, she can't talk. Because anytime she would try to speak, she would lose her breath and the heart rate would go up. So she had to live for months without speaking and barely gasping for air. Barely. Again. and a constant coughing was going on. Now, her examination, which I doubt you've ever heard anything like this before with the doctors that you've been to, with all the top type of MRI and CAT scan machines and incredible extensive blood tests you may have done, and even a spinal tap if you've gone that route, or doctors have gone that route for some reason, or a nerve conduction study, or an EKG test, or a stress test. I doubt that they're giving you this kind of information I'm going to share with you right now. And we've got to understand, before we even get into the exam findings and the protocol that she's following right now, we've got to understand when it comes to POTS, when it comes to your inability to regulate your heart rate in different positions, when it comes to shortness of breath, until you can actually peek inside the tissues and understand without a biopsy, you can peek inside those tissues and find which kinds of hidden infections and toxins are causing the symptoms. You're going to suffer with these symptoms for many years to come. And even with the medications that might help control your rapid heart rate, or might help with blood pressure, or might help with breathing, or might help with congestion in the sinus, or might help with your digestive system, whichever symptoms you're dealing with, everybody is different. Not everybody has the exact same symptoms. Some people can have 2 symptoms with POTS, some people have only 1 symptom, some people have several different symptoms with headaches and migraines and dizziness and nausea and diarrhea and constipation and bloated belly, and there could be a lot of different things. And fatigue, of course, and insomnia and anxiety and panic and depression can even occur with this. But we've got to understand something when it comes to POTS and when it comes to respiratory conditions, that the whole body is connected. There are different circuits within the brain and the brainstem and the spinal cord which help us regulate our breathing, that help us regulate our heart. There are different parts of the heart that help us regulate the heart function. There are different parts of the respiratory system, the bronchioles, the bronchi, the trachea, the nerve that comes out of the brain that goes down, and brainstem that goes down to the trachea, to the lungs, to the diaphragm. We've got to understand that there's the cardiovascular system that we've got to understand to a great degree. We've got to understand the nervous system, the central nervous system, peripheral nervous system, to a very great degree, the functions of the different tissues of the brain and brainstem, to help us really understand what could be going on between brain and heart, and brain and digestion, and brain and the respiratory system, and so on. We've also got to understand there are hormones involved that help regulate brain function and heart function and respiratory system. Not just testosterone, not just estrogen, not just thyroid hormones, not just adrenal gland hormones that might be tested in an adrenal test. There are many different hormones that come out of different tissues in the brain, and I won't get into too many scientific names right now. Not here to make you into a doctor in this video, but there's many different tissues that can help us regulate brain chemistries. We've got to also understand, in addition to the endocrine system, we've got to understand, and the nervous endocrine connection, we've got to understand about neurochemistry. We've got to understand about the different circuits that are connecting from different parts of the brain, these different synapses and the different chemicals like serotonin, for example, or like dopamine, or like acetylcholine, and there's others. Too many to list here. We've got to understand about neurochemistry. We've got to understand about the dental connection, possibly, of teeth and infections in the teeth and root canals and mercury fillings and so on, to the brain, to the heart, to the respiratory system, to your gastrointestinal system. Until the physician can understand and be able to connect by his or herself all of these different circuits that I've just mentioned, it's probably going to be almost I'll say the likelihood of your recovery from POTS is going to be slim, very slim, very, very slim. And so I have studied the nervous system in great depth, about the central nervous system, peripheral nervous system, about movement disorders, about developmental disorders in the brain and the whole autism and Asperger's and ADD, ADHD spectrum. I've studied in great degree for a few years with biochemistry, in neurochemistry, in postgraduate studies in immunology, neuroimmunology, dental work, very deep and detailed into this kind of work that I do, because we've got to understand all the different pieces, just about every single part of the way that different parts of the body function individually and how they connect to different circuits, like nervous to endocrine, nervous to cardiovascular, gut to brain, endocrine system with the heart, endocrine system with the gut. We've got to understand everything is connected, and we can't just pick apart and say, you're a cardiovascular patient, you're a nervous system patient, you're an endocrine system patient, you're an immune system patient. It just doesn't work that way in your body. I found with her, in her body, in my unique examination, I found that she had in the nasal mucosa, the inner lining of the sinus, I'll put a picture up next to me, in the inner lining of the nose up to the sinus, there's a layer called the nasal mucosa. She had the adenovirus in her nasal mucosa that we've already remedied with a specific, unique, powerful, potent remedy that she took on day 1. And she actually felt better by day 2 with her breathing. Day 2 or 3, she was already feeling relief. I found with her nasal mucosa the polio virus. Yes, the polio virus. Whether it was from a vaccine, active or inactive polio virus that was given to her in a vaccine, or who knows, maybe some mosquito was carrying the polio virus. That's possible, and she was bitten by a mosquito. There's many different ways that we can pick up these different viruses. The polio virus in her nasal mucosa, the polio virus in one of the sinus cavities called the membrane or the sphenoid sinus. The sphenoid sinus, I'll show you a picture. It's deep inside the skull. She had the polio virus there as well. I also found with her that she had the polio virus in the basilar artery. This basilar artery is an artery which feeds blood right into your brainstem, and you have inside this brainstem tissue, which gets the blood from the basilar artery, you have circuits, I'll say, or areas that are the controlling centers to your respiration, or influencing, I should say, centers to your respiration, to your digestion, to your pupil function, to your balance, to your hearing, to your taste, to your tongue, to your swallowing, to your digestion, to various organ and body functions that come out of this brainstem tissue. And when the artery that brings the blood there, the basilar artery, the poliovirus is there, it's going to stress, you're getting inflammation patterns that are going on there, and it's causing let's say, like a paralyzing or a decrease in function disorder that's happening in there. I also found in her lungs the influenza virus. I found in her lungs the polio virus. I found in her bronchioles, inside the lungs, you'll take a look at a picture of the bronchioles right now. I found the Haemophilus influenza B virus. I found in the bronchi in her respiratory system the same Haemophilus influenza B virus, and those were causing a decrease in the function of her respiratory system. I found residues of the vaccine, of the TB vaccine in her diaphragm, which the diaphragm sits right under the lungs. I also found that she had in her kidneys, let's go there now, in her kidneys, residues, chemicals from the DPT, diphtheria, pertussis, tetanus vaccine. I found in her left kidney the polio virus, which she hasn't even gotten to that step yet in this protocol. I also found in the red nucleus of her brain. The red nucleus is something that we've got to understand in a great degree of how the red nucleus of the central nervous system in the brain helps us control motor functions in the body. And motor function is part of how we're going to have a normal heart rate or heart rhythm, because the heart function is a motor control. So the red nucleus, which is really important to study when it comes to POTS, the red nucleus is really important when it comes to study about a condition like a Parkinson's condition, or somebody's having weakness of digestive function, even with constipation conditions or bladder control disorders, overactive bladder, interstitial cystitis. This red nucleus is really important in every motor function in the human body, or let's say just about every single motor function that I've learned about or can think of. The red nucleus is involved in all of these different motor controls, including breathing, because that's a motor control. Think of the red nucleus as if you could take a funnel and put it into the top, you twist off the oil cap. Let's think about your car. Lift the hood, you got to put oil in. Twist off the oil cap, put a funnel in there, take the quart of oil and pour it into the funnel, but the funnel is clogged. The funnel's clogged. How is the oil going to go through the funnel and get into the engine? It's not getting there, or it won't get there efficiently. If it's clogged to, let's say, 80%, some will drip through, but not all. So, or rapidly, all of it not dripping through. So, the red nucleus is sort of like that funnel. We've got to make sure that it's clean and clear and has no kinds of chemicals, mercury, lead, insecticides, pesticides, weed killer spray from food that you've eaten, antibiotic chemicals, and any fungus, mold, virus, parasite, bacteria that can get in there. We've got to make sure it's clean to get normal function. Again, I'll tell you, in the red nucleus in her, I found the tuberculosis vaccine chemicals. I found in her, let's see if we had some more red nucleus here. No, not in this exam. I found in her right kidney, I found chemicals from the water that she was drinking from the store. The water that she was drinking, the store brand water, which is bottled, and she thought it was, and her husband thought it was healthy, lead. I found some lead contamination in the water that she was drinking. So that was in her right kidney. I found a sample from that water that she was drinking with lead contamination in it, in her red nucleus. I also found chemicals, and I won't say the bottled brand of a certain apple kind of a flavored apple type drink, but there was also contamination of lead in this drink. I found that in the small intestine. When the intestines are stressed, the brain can be stressed, the heart can be stressed, it goes all around. I also found with her that she had in her large intestine more of that lead contaminated water saturated in there. Listen, if you took a white t-shirt, think of this analogy for a moment. Take a white t-shirt, put it into water that has a blue dye in it. Leave it there for 10 seconds. Take the t-shirt out of that water that has blue dye, and the t-shirt is no longer white, it's blue. Let it dry for 24 hours. All the fluid has left the water, but the dye remained. The white t-shirt is no longer white, it's blue. Now put it in the washer and dry it with no bleach, just water by itself or with some detergent, clothing detergent, and when it comes out, it's still going to be blue, that t-shirt. It doesn't return to white without some chemical that's going to take the blue out, like a bleach. So when we absorb these, that we are what we eat, you've heard that before, you are what you eat. When we absorb different chemicals from the foods that we're eating and the drinks and the fluids that we're consuming, we are getting any kind of chemical that could be there that we don't realize is there, because the water might taste fine to you, or the drink, bottled, apple drink or bottled juice drink or bottled tea, iced tea or something tastes fine, or bottled coffee can taste fine to you, yet you can have contamination in the fluid that made that drink, like lead or like mercury or radon or so on, that could be in that water. Pesticides can be in there. I found that same sample of that store-bought brand bottled water, that lead contamination water, in her large intestine. I found the adenovirus is throughout her bloodstream. The adenovirus throughout the bloodstream. She hasn't even taken that remedy yet. When you saw this incredible improvement video that we're describing, or that you saw that interview. I also found in a part of the brainstem known as the pons. The pons has cranial nerves coming off of it, which help us regulate our diaphragm. Part of it helps regulate diaphragm. Part of it with some certain facial functions. Part of it goes down to digestive areas and heart function and so on. Excuse me. The pons also had the adenovirus in it. Now she's taking remedies which are liquid remedies that are, let's just say, infused with, programmed with these viruses. I'm not giving her viruses, but we're giving her the energy of the virus. I'm not going to go deeper into it right now. To be able to get rid of that virus, like cures like. And no, I'm not treating or curing the condition. I'm providing her remedies that are going to remove these different chemicals and remove these different infections so the body can start to breathe, no pun intended, as you saw with that video of her describing how much better she's doing in just the first month of this unique protocol, after nothing that was performed in 4 to 5 emergency room visits, nothing that the psychologist, nothing that the cardiologist, and nothing that an acupuncturist could get done for her. No blood test, no CT scan, no MRI was able to figure it out. No urine test was able to figure it out. No EKG was able to figure it out to help her reverse this condition. She is breathing. She's not short of breath. She's feeling so much better. She's functioning so much better. So we can, with my work, you and me, your family member and me, we can, and my staff who's here in my clinic, we can help you figure out what it is that's causing your POTS and or respiratory condition. We can help you figure it out. We can help you find which different hidden infections and toxins are in your tissues. And I'm going to run down a list one more time of these different infections and toxins I found in our tissues. You can help yourself reverse the condition. We've got to understand the different systems and how they connect in the body. I've had extensive education for the past 11 years of postgraduate studies in neurology, neurochemistry, immunology, biochemistry, the dental connection to these different nervous system and cardiovascular and respiratory disorders and gut disorders that people suffer from. I've had extensive studies in developmental developmental disorders of the brain and that whole ADD to Asperger's and autism. I've had extensive studies in gastrointestinal disorders. I've had extensive study in functional blood chemistry analysis and endocrinology analysis. I've had extensive studies in the in alternative cancer work. The goal is to get you better. It can be done. And you're seeing living proof of this woman right now who's getting better. She's doing phenomenal in this protocol, and I believe that I've got the skills, the tools, and the knowledge to be able to help you, and the passion about this, to help you get well also. Whether it's going to happen as fast as her or a bit slower than her, it can happen. The speed of recovery varies from one person to another. You're going to be handled individually. The exam is completely different. My consultation, my investigation appointment before the first examination is completely different than what you've had done with other doctors so far. Insurance policies do not cover this work that I'm offering. There are no codes that we can bill the insurance policies, no matter what the insurance policy, whether it's a PPO or an HMO or any other kind of policy that you've had from any business. There are many different policies my staff has made attempt to bill in the past, but there are no codes, insurance coding for billing that we can actually find that actually fit the kind of work that I'm offering you. So this will be an investment on your own, in yourself, in your family member, in your friend, to help this person get well, to help you get well, or a family or friend, a family member or friend to get well. You can call my clinic at 954-370-3100 when you're ready to set your appointment. You can even email my office here. I'll put the email address of my office, the clinic assistant, scheduling assistant, at the bottom of the screen here as well. Again, the phone number is 954-370-3100. And again, the email address is here on the screen. You should also, after watching this, share this video with one friend who you know is suffering from a respiratory problem, a shortness of breath problem, a POTS condition. Share this with that person. Also, you can like me on my Facebook page. I put up information there. There's many posts you can go through on my Facebook page and see different kinds of treatments, different kinds of positive results that patients are getting from my work here, different understanding of how to appreciate these chronic conditions and help to unravel these chronic conditions. You should also maybe follow me on my Instagram. I put up information there all the time. They're pretty easy to click on those different images and read about and even watch some videos of people that I put on my Instagram. And subscribe to my YouTube channel, because I put up wonderful videos here that have incredible in-depth presentation and just amazing testimonials, amazing reports of patients who are getting better with my unique work when nothing else worked for them before. I'll even put up here some images, screenshots of other videos that I think would really help you get a better appreciation of the kind of recoveries that are taking place in my clinic. So you'll be able to find these videos and watch them as well. The more you learn, the more knowledge you have, the more you can appreciate of somebody who's really getting the job done for other people. You may just be able to appreciate that you have the opportunity, you have the chance to get better also. I look forward to helping you. Again, the number, 954-370-3100. Look forward to helping you soon.